Hey everyone, it's Josh Silver, founder and president of Pulse Energy Technologies here in Los Angeles, and I'm here for another one of our clinic spotlights. And this is a very special guest. This is somebody I've known now for several years who resides on my most favorite place in the world and is a very, very well respected sports medicine practitioner in the community. And I want to introduce to you guys Ross Oshiro, who is the founder or the owner of Hop Sports Medicine in Hawaii. Good to see you, man. How are you?
How you doing? Nice to have you. Nice to be there.
Thanks for being here. For all of us that don't, all the people out there that don't know your background, just give us a little taste into your background into sports medicine and a little bit of your journey.
Okay. I'm an athlete trainer. I was a traditional athlete trainer coming from high school setting, secondary setting. I've been doing athletic training for over 30 years now. So my partner and I, who is also an athlete trainer, started this company, Hawaii Optimal Performance, about 20 years ago, a little over 20 years ago. And we did it because we saw a lot of ACLs happening in our high school athletes. So we tried to develop prevention programs to treat our athletes from a very young age, from middle school all the way up, and we've had good results. Currently, we've added chiropractic to our services. So not only the sports medicine, we've added chiropractic with their adjustments and their soft tissue work, and with the PEMF that kind of enhances everything.
Awesome. And so that was going to be my next question is tell everybody out there just sort of how you discovered PEMF along your journey, where it's fit in, and what your first impressions were when you guys discovered it and ultimately when you guys tried it and then got one.
Sure. Prior to the pandemic, we were primarily a sports performance rehab type of company. But with the pandemic, like a lot of clinics, we've had to downsize. So in the process of downsizing, I was looking for another type of treatment that we could offer to our clients and patients. And I got one of your emails. And so it kind of intrigued me. So I looked into it, gave you a call, and we got started from there. With the demo unit that you sent over, I tried it on my shoulder, which I had a rotator cuff tear. And prior to using PEMF, it would take me 30 minutes to warm up before I could throw. But after one use, my arm felt so live. It was like I was 18 again, the way my shoulder felt. I didn't need to warm up, do all my exercises to get warm to start throwing again. And even to this day, I don't even have to do them to throw. I can just pick up a ball and I can throw, which just shocked me.
Awesome. Dude, you're not alone. I'll tell you, when I talk to the pro baseball pitchers, they say the same thing. And one of them was like, it's time travel. And I was like, it is time travel.
Yeah, unreal.
So you had a good initial experience, and then obviously I came over there. I spent time with you guys, and then you've been off and running now for several years. And I know we've talked quite a bit over the years with different cases, different people that you have worked on the machine with, from the top level of pro athletes to weekend warriors like myself. Are there any particular injuries, people, cases, things that you've come across in the last couple of years that really stand out with the PEMF that you're like, hey, it really helped this person?
We see a lot of high school athletes. So I've used it acutely, like next day type of treatment on them. And I think with our younger athletes, the recovery is a lot faster. So if I had one ankle came in, couldn't weight bear, came in on crutches. We gave him a treatment on his ankle. He was able to weight bear. And within a week and a half, he was back on the field,
Wow.
taped up and playing.
That's awesome. That's
Yeah.
awesome. It's when I get a chance to talk to the people that use the machines on a daily basis, the common theme that I hear, and this is as anecdotal as possible, it's the reduction in recovery time all across the board from the variety of injuries. And it just seems to be that is starting to be maybe where the niche is for this technology is just the recovery time from any sort of injury. When you hear 6 to 8 weeks, a lot of the time people will say to me, I hear 6 to 8 weeks, and in reality, it turns into 2 to 4, 1 to 3. And it
Yeah,
becomes almost
yeah,
a challenge on how quick you can get them to the point of clearance. My next sort of thing that I wanted to ask, which ties into is something we were talking about off camera, is the other thing that I'm hearing a lot of feedback from physical therapists, chiropractors, athletic trainers, all sort of different walks of life is that essentially it's interrupting the inflammatory cycle, that they're seeing quite a bit of results with inflammation all across the board. Can you speak to that a little bit? Maybe a couple cases or a couple things that you've seen where you go, this is where it sort of comes into play.
yeah. So I think this is the number one use for this technology. We have athletes post ACL that come in to train. They may be back to their running. They come in a little flared up, a little swollen. We put the machine on them, do some soft tissue work, and get them back training again without the pain. I've seen this happen several times especially with our knee patients. Some of our older clientele, and I think the fastest growing sport in the country is pickleball.
Boy,
And
is it, yeah.
pickleball, the injuries, ankles, knees, shoulders, backs. And the population for that are the 50 plusers. So they want to get back onto their court. They want to play, and they don't want to sit out. They're almost like athletes, high school athletes. They're very
Sure.
impatient. So getting their inflammation down with their shoulders has been incredible. They feel great. It takes a little longer. With them, we can't do it in that first 4 treatments. It may take 8 treatments, but we're getting them back playing again.
I mean, that's awesome. And I feel that that ties into what we were talking about earlier. That's probably a big part of how you're reducing the recovery time is that inflammatory process where a guy, like in my head, I was thinking, well, if guys are coming back post ACL and they're not having setbacks and they're not having swelling, things like that, they can then go do the work that the athletic trainer or the physical therapist is doing to rehab them or that him or her and get them back faster. It just seems like that's a logical connection. It's, when I was first involved in this 25 years ago, people thought it's some sort of magical wand and you're creating a miracle thing. And now that there's been all this data, right? People like you using it, it seems like that's maybe the process where it fits in for most people.
Yeah, the other really big one that we've used it on is on shin splints, stress fractures. We've used it on female athletes, both high school and collegiate, getting back to track cross country. MRI shows the stress fractures. We put it on one girl this past summer. She was home. We put her on only once a week. And a second MRI showed that there was bone growth within that same stress fracture. So she was feeling comfortable. Doc was feeling comfortable about getting back to her sport. So I think shin splints, stress fractures, we've had huge success with. Being an athletic trainer for over 30 years, I've tried a lot of different modalities. Um, and probably about when I was in year 20, I stopped using them. I just relied on my
I remember you
hands.
told me that. Yeah.
Yeah. So E-stim, microcurrent, Russian stim, interferential. I tried them all. The old galvanic stim, I tried
Yeah.
all of it. And it only helps very short period of time. So I stopped using them. I just used my manual skills and got my athletes back that way. But with this, PEMF has enhanced the soft tissue work, enhanced the recovery, the rehab. We can start all of that quicker and get these athletes back. The, this machine is, yeah, almost like magic.
I hate to say that it is because obviously it's my company that's making this one, so it's hard to not sound like a homer or a home fan. But I hear this a lot, and it's really cool to hear. And I will tell you what's awesome is you're a believer yourself. You talk about the beginning how it worked on you. So I imagine there's a lot of practitioners out there that have a lot of toys or tools, but they don't actually use them on themselves. So to hear that you stop using modalities, but then you'll use this on you, not just your patients, I mean, it's cool to know that it works. I have another question related to, so we get a lot of new practitioners, people that are just getting the machine that understand, hey, this thing works. This has worked on me. Uh-oh, now what do I do? Is there any sort of guidance or advice you can give to new folks in the PEMF world on how to integrate it as best as possible into their practice? Some of the things that you guys did successfully?
I think knowing some of the research out there, because you'll have those patients that want to know what does the research say about this product. Having that background will allow you to speak better to your patient, your client. And then I think letting them taste it, like giving them a trial, letting them try one or two times, see how they feel, and get the patient comfortable with the machine. I think that always helps. And I think it's not so much you're trying to sell the product to them. It's more like once they try it, they feel better. So it's kind of, oh, I want that again. I wanna feel that. I think that's the best way to do it.
I have said to a few people lately, the sale is we're really trying to sell somebody on letting us give them a little bit of good results for nothing. And that's really what
Yeah.
we're trying to do is just prove ourselves. One last question from a monetization standpoint, from a return on investment, without giving us the numbers, and you don't have to share that. I hear from different people the way that they have monetized it. I have one group that does it like a gym membership. They have all their people that come in, they pay a flat fee and they can use it. I have other people that do PEMF only per package, individual sessions, and I have other people, a lot of the chiropractic places that just charge one flat fee that include the PEMF. If you could share just what model you guys have seen the most success with, that would be awesome. Gives us a little bit of a sort of look behind the curtain.
So we do it two ways, and you mentioned them both. One is selling a package just by the PEMF themselves. That one is mainly for the people that don't really have the time, and
Okay.
that just want the quick results with the PEMF and go, or they use it as a post recovery after a workout.
Sure.
The other way we do it is we sell it as an hour package of soft tissue work, exercise, and the PEMF, all in one package. I think that's probably the best way that we use the PEMF. I think it
Awesome.
enhances everything.
And I think from that method too, you're putting them in a position for the success because you're getting the yin and the yang. You're getting the manual work, and then you're getting the modality after, and that seems to be the sort of the best recipe of the soup. Before we go, is there anything else that you want to share about PEMF? What you've seen for the viewers out there?
Um, I think this is an awesome product. It's not. I mean, it's you hear that about medicine that this one medication will help you with multiple injury or multiple diseases, and this machine actually does that. It helps you with acute injuries. It helps you with chronic injuries, and it can be from head to toe. We've had it on people's heads for concussions. What's the other? Vertigo. Unreal
Yeah.
results with vertigo.
Yeah.
So I think once you try it and you use it on a daily, you see awesome results.
Awesome. I love it. I say the same thing, and I feel good saying something that I know that you're saying too. Thanks for all the time that you shared with us. Thanks for letting us look behind the curtain a little bit and see how you guys do it and hear some of the success stories. I'm going to put a link to your guys' website on here. So if people want to check you guys out a little bit more, they're there. I'm ever so grateful for all your time. And if you guys need anything from us, don't hesitate to reach out.
All right. Thanks a lot.
Take care, man.
Nice start chatting. Okay. Bye bye.